Among the physical assets of a woman, the part that reveals her feminine beauty most obviously would be the breasts. But despite the increasing interest in having beautiful breasts, the reality is that there is not enough awareness about the normal and healthy state of breasts. Development of a woman's breasts begins at puberty and reaches maturity upon breastfeeding for the first time. Then, after menopause, a major part of the breast, known as adipose tissue, degenerates and atrophies. If at any time during the cycle, abnormalities and diseases of the breast become apparent, a serious concern for women arises. Today, through the eyes of Oriental medicine, we will examine the causes and treatments of female mammary diseases. In Western medicine, diagnosis of breast disorders involves an array of methods such as the X-ray, ultrasound, and tissue examination. In Oriental medicine, the four basic methods of seeing, hearing, asking, and feeling or touching is used first. These days, DITI is used for a more objective and accurate diagnosis of breast disorders. This diagnosis machine uses a very fine detector to detect the various levels of heat that emanates from the body and shows the levels in different colors through a computer. This is totally harmless to the body and can easily detect disorders invisible to the naked eye.
Oriental medicine explains that for the proper functioning of the lungs, the Jokyang-myeong-wi-gyang, or stomach meridian, and the Jokwol-umgangyang, or liver meridian, are the most important of the 12 meridians in the body. The first line of the stomach meridian starts from the top of the head and runs down the side of the face. The second line starts below the eyes, passes through the jaw to cross the first line, then passes through the front of the neck, the middle of the chest, and the abdomen, runs down the front of the leg, and ends at the point on the outer side of the second toe. The liver meridian governs the growth of each part of the body as well as the psychological process. It starts on the outer side of the big toe, passes through the inside of the leg, and runs up the waist before ending below the ribs. Generally, it is well known that more treatments have been developed for mammary diseases by Western medicine, but Oriental medicine also has various treatments for the causes of mammary diseases using constitution as a focal point. So, let's examine the Oriental medical methods of treatment such as herbal remedies, moxibustion therapy, and acupuncture. For cases where there are problems in the stomach meridian, it is necessary to replenish blood and ghee, and the usual prescription is shipjeon taebotang. This prescription replenishes blood and ghee in our bodies and is made by combining sagunjatang, which replenishes ghee, and samultang, which is a famous prescription for replenishing blood. Added to this is hwangi and yukgae. Hwangi replenishes ghee and helps blood circulation. Yukgae also replenishes yang-ghee and helps blood circulation. So when there is something wrong with the stomach meridian, shipjeon taebotang, which is a combination of these 10 herbs, is prescribed. When there is something wrong with the liver meridian, the most common prescription is gamisoyosan. The main ingredient is dangui. This herb replenishes blood and ghee. Another important ingredient in gamisoyosan is chija. This herb is shaped like a heart, and it actually does cool heat in the heart. Gamisoyosan, made up of these herbs, enhances the flow of ghee that had been bunched up in the liver meridian. For cases where there are problems in the stomach meridian, moxibustion is first applied to the jeonjunghyul. Jeonjunghyul is in the center of each nipple. This moxibustion point helps resolve the blocked gi in the chest and thus serves to enhance blood circulation. Another method would be to apply moxibustion to the joksamrihyol in the leg. This is located 3 chon below the knee bone. Chon refers to the unit of measurement used in Oriental medicine to measure the distance between the kyunghyols. Chon is equal to about 2 centimeters. Bisuhyol in the back is another point used in moxibustion for the treatment of disorders in the stomach meridian. Bisuhyol facilitates the function of the stomach. It is located 5 vertebrae above the middle of the back, 1.5 chon away from the spine on each side. When there is something wrong with the liver meridian, moxibustion is applied to the gansuhyol. This is 7 vertebrae above the waistline, 1.5 chon away from the spine to each side. In the foot, the daedonhyol is effective in the treatment of the liver meridian. The daedonhyol is also the starting point of the liver meridian and is located on the inside of the big toe. Besides the 12 meridians usually mentioned by Oriental medicine, the samjunghyol has been discovered recently to be effective on breast disorders. It is located 7 chon above the outer ankle bone.
Now let's look at the methods of preventing breast disorders. First of all, cut down the intake of fats. It is better to eat fish than meat. Fish contains omega-3 fatty acids that are especially good for breast disorders. Also, take foods rich in vitamin A. Good examples are vegetables such as carrots and tomatoes, as well as fruits. As we become more of a modern society, the cases of female mammary diseases start to rise. This can especially be noted by the increase in breast cancer, which can occur due to the lack of breastfeeding when the mammary glands are full. But, as we discussed before, periodic self-examination and attention to your bodily changes can play an important role in the prevention of these mammary diseases. Until next time, this is Oriental Medical Digest.